Hi, my name is Whitney Minter, and this is my clinical teaching project plan titled Correct Electrocardiogram or EKG Placement in the Primary Care Setting. Needs Assessment. Heart disease is the leading cause of death in both men and women. 1 in every 4 deaths is related to heart disease. Every year, 735,000 Americans have a heart attack. EKGs are one of the most commonly used diagnostic methods for cardiac disease. Inaccurate lead placement can lead to misinterpretation. Description of learner. RNs, LPNs, and CMAs working in the primary care clinic are the primary learners. The ages range from 24 to 55 years. Races include Caucasians and African Americans. 100% of the population is female. Reading and writing skills appear to be adequate. All learners have secondary education. Language spoken is English 100%. No cultural considerations were identified. Experience levels range from 3 to 20 years. Technical skills appear to be adequate. All learners have experience with the electronic medical record. Goal and objective. The goal of this teaching project is to improve the accuracy of EKGs by using proper lead placement and proper patient positioning. By the end of the learning session, 90% of RNs, LPNs, and CMAs at Carolian Clinic will be able to list 3 factors to consider when positioning a patient for an electrocardiogram, discuss 3 rationales why correct EKG placement is important, and identify correct placement of the EKG leads on 5 simulated patients. The method of instruction will be simulation. Simulations are instructional scenarios that the learner is placed in by the teacher. Prior to the simulation, learners will participate in a presentation with educational handouts. After the presentation, multiple 5-minute simulations will be performed, with debriefings following. Each simulation session will include a maximum of 4 to 5 learners. Following the simulations, a collaborative classroom session will be held to recap, provide additional feedback, answer questions, and schedule follow-up training if necessary. Review of the literature and methodology. One article that was reviewed was the effects of simulation-based learning using standardized patients in nursing students, a meta-analysis. This type of study was a meta-analysis. The level of evidence was 1. Summary. The article utilized a search of several online databases and several Korean electronic databases. A meta-analysis of 18 controlled trials was completed. The conclusion was that simulation-based teaching has valuable effects on cognitive, affective, and psychomotor domains of learning. The second article that was reviewed was entitled Effectiveness of Patient Simulation in Nursing Education, Meta-Analysis. The type of study was a meta-analysis, and this also was a level 1 of evidence. Summary of the article is it was a search utilizing electronic databases. It identified a total of 2,503 potentially relevant articles. However, 27 articles were included in the final analysis. The article concluded that in regards to educating nurses, simulation-style education is more effective than traditional learning methods. The third article that was reviewed was the use of hospital-based simulation in nursing education, a systematic review. The type of study was a systematic review. The level of evidence was 1. This article was a literature search completed in various online databases, which yielded 224 citations. 65 results were included in the final review. The article concluded that more randomized controlled trials and studies are needed to understand the influence simulation has on practicing nurses and patient outcomes. The final article that was chosen for review was titled Systematic Evaluation Influence on High-Fidelity Simulation Teaching on Clinical Competence of Nursing Students. The type of study was a systematic review. This also was a level 1. In summary, the review utilized various electronic databases and included 12 studies published from 2000 to 2014. The article concluded that simulation is beneficial in improving nursing education and clinical skills. Synopsis of the literature. Of the 4 articles reviewed, all of the articles focused on teaching nursing students. 3 of the 4 articles concluded that simulation has beneficial effects on learning. 1 of the 4 articles concluded that more research is needed to determine the effectiveness of simulation. The rationale for selecting simulation. Simulation is becoming more prevalent in nursing education. Simulation is effective in teaching students in a timely fashion. Nurse educators must continuously evolve and find effective ways to educate students. The learning theory that was chosen was cognitivism. Cognitivism is cognitive learning that allows an individual to monitor and detect errors in order to learn from them and improve performance. Knowledge is retained from memory. Demonstrations and rehearsals are beneficial. This selecting teaching method, simulation, fits with this learning theory because simulation will allow demonstrations and rehearsals. The appropriateness to the audience. Once again, the target audience is RNs, LPNs, and CMAs. Simulation has been proven effective in teaching healthcare professionals. The outline of the teaching content. Objective 1, which is to list 3 factors to consider when positioning a patient for an electrocardiogram. The content will be presented in a PowerPoint presentation that will discuss factors to consider, including patient acuity, patient mobility, patient habitus, and potential bodily deformities, as well as nearby electronic devices. The method is a PowerPoint presentation. Staff will be given a handout of the presentation. Information and knowledge will then be applied during the simulation and reviewed during the debriefing process, and further discussed in the collaborative classroom session. The time allotted is 60 minutes total. The teaching content will be evaluated with a post-simulation test and survey. Objective 2, discuss 3 rationales why correct EKG placement is important. The content will be presented in a PowerPoint presentation, which will discuss that incorrect EKG placement can lead to misdiagnosis, delayed treatment, and inappropriate treatment or mortality. A PowerPoint presentation will be presented prior to the simulation. The staff will be given a handout of the presentation, and then once again, information and knowledge will be applied during simulation, reviewed during debriefing, and further discussed in the classroom session. Time allotted is 60 minutes total, and this will be evaluated with a post-simulation test and survey. Objective number 3, identify correct placement of EKG leads on 5 simulated patients. The content will be presented in the PowerPoint presentation, which will provide images of correct and incorrect lead placement. The method for presentation is the PowerPoint presentation, which is presented prior to simulation. The staff will be given a handout of the presentation, then information will be applied during the simulation, reviewed during the debriefing process, and then discussed once again in the collaborative classroom session. Total time allotted for the entire presentation is 60 minutes total. This objective will be evaluated with a post-simulation test and survey. Learners will be given a post-simulation test at the end of the collaborative classroom session. The post-simulation test questions will include: what are 3 factors to consider when positioning a patient for an EKG? What are 3 reasons why EKG lead placement is important? Where do you place the EKG leads? The simulation will be evaluated with a survey. Learners will be given a post-simulation survey at the end of the classroom session, which will evaluate both the presentation and the presenter. Additional resources will be provided to any learners that need additional assistance. And here are a list of references that were used for the clinical teaching project plan. And that concludes my presentation. Thank you.